Thank you all so much for joining the fifth installment of this webinar. 1 week ago, on Thursday, September 12th, the World Health Organization, along with UNICEF, UNRWA, and local partners in Gaza, concluded the first round of the polio vaccine campaign in Gaza. The first round was rolled out in 3 separate phases, each of which were 3 to 4 days and 8 to 9 hours a day. And while, of course, it's good to hear of any pauses, it's especially disheartening to hear about children who were vaccinated in the morning, whose tents were bombed at night. It's not the only health challenge in Gaza right now, and our panelists are going to discuss some of the other health challenges also coming up in Gaza. To successfully vaccinate all the children under 10 in Gaza, 2 doses of the polio vaccine need to be administered 4 weeks apart. The next round is scheduled to begin mid-October, and we hope that this second round of the vaccination campaign can have more robust pauses, and that this can really be an opportunity, an opening for a ceasefire to be negotiated. Here to speak more on how the polio vaccine rollout went and what conditions are like on the ground is Dr. Majed Jaber. He is currently in Mawasi. He is an emergency physician and worked at the Emirati Maternity Hospital before Rafah was invaded in May. And then he worked at the European Gaza Hospital in Khan Yunis until the Israeli army ordered the area to evacuate in early July. We had planned to have Dr. Jaber join us in the last webinar, but he was unable to after narrowly avoiding Israeli airstrikes. And so we're really grateful to have him here with us today. He's just coming off of a 24-hour shift. Thank you so much. He's also going to be joined in conversation with Dr. Tammy Abughnaim. She is an emergency physician based in Chicago. She has traveled to Gaza on two medical missions, the first in Al-Aqsa Hospital in March before the Rafah border was closed, and she just returned from her second at Nasser Hospital in August. And they are both joined by Dr. Jeff Goldhagen. He is the president of the International Society for Social Pediatrics and Child Health. He will discuss the important role that physicians, pediatricians, and child health professionals can play in addressing all the global challenges to child health. Thank you all so much for being here. Dr. Jeff?
Yes, thank you. Thank you for joining us. I'm going to be uncharacteristically short here because we have two really important and courageous individuals, physicians who have been working in Gaza and can provide us the perspectives and information that we need. I can tell you I've in the past worked in 3 war zones in Africa and Southeast Asia. And the pictures and the information and the dialogue we're hearing from our colleagues who are on the ground and have been on the ground in Gaza are orders of magnitude greater than anything that I've witnessed. And in talking with multiple colleagues and friends who have worked in multiple different war zones in the past, certainly more than the devastation is more than they've ever seen. And that information comes back to us on a continuous, ongoing way from all of those that have actually been on the ground, and we'll be hearing today from 2 folks, 2 physicians, 2 courageous physicians who have been working there. Last week, we heard on another Rebuilding Alliance briefing from other physicians who corroborate this. And so we're left, those of us who are not on the ground and haven't been on the ground are left with the nagging question, the burdening question of what can we do? And we'll talk about that after we hear from our colleagues. Ultimately, at the end of the day, every humanitarian, every justice and every rights premise that we hold dear to our hearts has been violated in this conflict. This conflict is different from any others, certainly that I'm aware of, with the lack of access to humanitarian resources and humanitarian aid, the lack of capacity to evacuate, in particular children, who are suffering at great deaths, is in some ways very different than any other conflict that certainly, again, that I'm aware of. I'm going to stop here. Allow our two colleagues to talk in more detail as to what they're seeing. The issues related to polio, while important, are the tip of the iceberg. Again, there was a question when the campaign to the polio outbreak was being discussed. Could WHO, could UMRA, could UNICEF actually accomplish what they needed to accomplish? And in fact, they did exceptionally well. Out of the 650,000 children that were estimated to need to be vaccinated, well over 550,000 of them actually received vaccination. That was an act of courage, and that was a reflection of the tremendous expertise that is available to respond to this conflict if only they were allowed to do so. So I'm going to turn this over to Majed and allow him and Tammy to talk with us actually about what is happening on the ground in Gaza, and then we'll follow this up with a dialogue about what we can do to respond. Majed?
Hello. I'm really grateful for, well, all of you to provide me with a platform to share my view and perspective as a doctor in Gaza. As you know, healthcare workers and the situation in Gaza is difficult to tackle and cover from an outsider perspective, and it's really valuable to ask what we experience on a daily basis. I've been working on a daily basis since the start of October 7th, and what I've learned during my work at the emergency department and outside it is that emergencies occur mostly outside of the hospital, and they barely or rarely reach these hospitals, and they take many forms that, well, it's not only airstrikes and mass casualty. You have a lot of children, and you have a lot of pregnant women, and you have a lot of vulnerable people that do not reach the hospitals, yet they need utmost care, and they provide the most preventable deaths, let's say. Gradually during this year, it's been more difficult to prevent deaths from an airstrike, from mass casualty, and this has been evident from many doctors who work here or who came here, witnessed that many times through their missions. But we tend to avert our eyes from the less graphic cases, which are, let's say, for example, children. And another less graphic topic, hygiene and sanitation. The destruction of the infrastructure has been ongoing since day one. And it's been incremental to the level that we don't have any infrastructure anymore. All of Gaza Strip has been destroyed, even infrastructure, the sewage pipelines, the water sanitation centers. It's been ongoing, and it's really hard nowadays to find clean water. We've been struggling with it since November, but now it's just abysmal. We've been struggling with finding clean public toilets for those who were displaced, and now it's also non-existent. This gradually created this problem that people are not allowed, or they cannot really clean themselves properly. if you can't find soap, if you can't find shampoos, if you can't find clean towels, clean clothes, if you can't find alcohol gels, the problem of hygiene becomes a very major topic. It creates a heavy burden on the health sector, creates a great burden on us here in Gaza. So in November, we witnessed the rise of hepatitis A. And hepatitis A spreads mainly via the fecal-oral route, which happens because people cannot clean themselves properly in a very crowded areas, crowded to the extent that a small school that used to have 100 or 200 students now housing 4,000 displaced people, a highly crowded area. Even if we had the hygiene facilities, we will still suffer from these consequences because we cannot isolate patients the way we used to before. We had a lot of cases of diarrhea. Even at some point, the UNRWA was warning from cholera spread because we had some cases of people dying of diarrhea then, which is like a very, very severe form of it, which killed some people because of the loss of salts and electrolytes. And it was unsalvageable because due to lack of access to healthcare centers back at the time. And then it developed the cases of, hepatitis A are still present. The cases of diarrhea are still present. Now we are going into a new stage where there is skin infections. These skin infections were at the beginning responsive to the empiric antibiotics that we usually have. We're talking about like the amoxicillin, the cephalexin, and these, let's say, common empiric medications, and now they're not responsive at all. Even worse, we're suspecting that the Israeli soldiers have spread some organisms that are endemic in the occupied territories, but not in Gaza. For example, the sand flies, leishmaniasis. These create very ugly ulcers. And it's really difficult to take care of them because they keep ulcerating and they keep getting infected. And now, during June, they detected the presence of polio. And polio spreads the same way as hepatitis A and the other infections due to these sewage pools not being able to, tackled with a sophisticated infrastructure. They just sit and create a favorable environment for any bad organism to develop. And because of the summer, you have a lot of humidity, the water evaporates, the viruses transform from another place to another, and they stay for about 14 days almost. So there's a huge window for these organisms to spread around. And it was a matter of time until we witnessed the first cases of polio, and we did. Now, the UNICEF mentioned that the vaccination rates plummeted from 99% before October 7th to about 88%. And this is really bad. You have 10% of these children not able to not only protect themselves from polio, which creates a lifelong paralysis and in some cases even respiratory paralysis, and then you die. There is no cure for it. Not only that, they only act as vassals for these organisms to spread around. And the misery is still go on and go on. So this is one of the most important things that I want to highlight, is that we tend to neglect these less graphic problems that are very crucial. We've been screaming for help. Please focus at this issue. We are still lacking hygiene equipment. We are still lacking in these facilities, yet no one responds. But yeah, thank you so much.
No, thank you. Well, why don't we go to Tammy, and then we can open this up for dialogue and discussion, in particular from your perspectives when we're able to talk as to what you need from us and what you think that how we can best respond. Tammy, do you wanna go next?
Sure. Thank you, Jeff. Well, first of all, thank you, Dr. Majed, for the important work that you're doing, and Allah ya'tik al-afiyah. I wanted to speak a little bit and just to kind of emphasize some of Dr. Majid's points. So as Nasreen mentioned, I've been to Gaza twice now since the crisis broke out, once in March in Deir al-Balah, and then the second time at Nasser Hospital in Khan Yunis. And what I can tell you is that despite, the medical community kind of screaming at the top of its voice about the lack of infrastructure, the lack of equipment, the lack of sanitary conditions, things have gotten much worse, excuse me. As Dr. Majid pointed out, things like soap, hand sanitizer, sterilization products are still not available in the Gaza Strip. And that is a direct result of Israeli restrictions. If you look on the World Health Organization dashboard on their website, they track exactly how many trucks, how many shipments, and how much equipment is sent to the border at any given moment. And they're tracking totals as well. So the total number of hand sanitizer and bleach and products that are necessary to contain the spread of infections are all well documented. And the numbers that actually reach Gaza and are able to enter Gaza are also well documented. And in preparation for this, I was looking at the dashboard, and 0.4% of the sanitation or of the hygiene products that are needed, specifically soap and disinfectant, have actually reached Gaza. 0.4% of what is necessary, which, we've been saying this for months and months and months. So when I was in Gaza in March, we were having the same issue. Like, there is no soap. In the emergency department, we're cleaning our hands with salt water and iodine, if we can find it. Most of the time, we're not even cleaning our hands, right? There are gloves available, but at the same time, you're running from patient to patient to patient. All of these restrictions are proving extremely challenging, and they're essentially choking the healthcare system from being able to intervene in a timely fashion in the spread of infectious diseases. The one that's topmost in everyone's mind right now is obviously polio. But essentially, Israel has turned the Gaza Strip into a petri dish. The lack of sanitation, the lack of clean water infrastructure, the lack of sewage infrastructure means that polio is only the first epidemic that we are going to see. And this has implications not only for Gaza and Palestinian civilians in Gaza, but for the region in general, because we know that viruses don't respect borders. And so healthcare workers are coming into Gaza and they are leaving Gaza. Soldiers are coming into Gaza and they are leaving Gaza, and all of this presents opportunities for the spread of infectious diseases. So I think having that global mindset should really be at the forefront of all of this, because the polio epidemic threatens the safety of the entire world, not just the safety of Palestinians in Gaza. To Dr. Majid's point as well about, the ability of healthcare workers to do their job. The polio vaccine rollout was, it was kind of the best that we could do under the circumstances, the best that the WHO and the United Nations could do under the circumstances. It's not ideal, and it wasn't without its problems. We saw, as Nasreen mentioned earlier, that there were children who were being vaccinated during the day who arrived dead at night at these emergency departments after their tents had been bombed. We saw that some of these sites were in fact bombed or had, or there was military activity happening right next to some of these vaccination sites. Getting to the vaccination sites is also a problem because Gaza's roads have been destroyed by Israel. There is not exactly a system of public transportation anymore. People are scared to go and travel to vaccination sites. So although this was a good, successful rollout of phase one, it does present kind of opportunities for improvement and as kind of a testing ground for these humanitarian pauses or humanitarian truces to be able to vaccinate the children of Gaza. But I think in the back of all of our minds as aid workers is the fact that you cannot vaccinate against bombs. You cannot vaccinate a child against malnutrition and starvation. And so really the key, for people who are interested in the public health aspect of it, the key is really going to be a more sustained cessation of hostilities in order to get us to a point where we can successfully implement these public health principles. So I'll stop right there. And
let me ask a quick question. The mental health issues, in particular in children, obviously when you have a child that needs an amputation, mental health is not necessarily the priority, but can you comment on what you're seeing, or if you're seeing the impact of these multiple months of conflict on, in particular, children's mental health?
Yeah, so the mental aspect, I think, is as important as the medical side, of course, because my recent memory is that the big massacre, the huge massacre that happened in Mawasi last week, the one I was close by. In these camps, there's a lot of people, but you start developing a new sense of community inside that camp, and you get really used to these children. And one of these children, he was injured during this massacre, and he lost one of his limbs. And after this incident, after he lost his limb, after he went through shock, he became a different kid. He used to be a little bit cheerful and playful, and like childhood innocence. They don't process the world as we do. And this is a theme not exclusive to this child, is that once they get into shock, they develop this mask face. And it stays on for months and months. There is that child also. He was popular, sadly. The child that was hungry and was opening a can of food, and it exploded, and both his hands and legs were amputated. It's really difficult to talk to these children because I've never seen textbook depression, just people going under traumatic stress. There is many children here with amputated limbs and amputated limbs that they mostly go through different degrees of depression, but they just don't care anymore. We've been talking to them about, trying to help them reach out to, organizations that try to, take care of them physically and psychologically. Some people try to sponsor some prosthetics, etc. And from my conversations with them is that they really don't care anymore. They're not enthusiastic about having a new prosthetic or traveling abroad. All they care about is I just want my mother. And I can't convey this in words. You have to see it. You have to see the purest form of emotion. Child wanting his mother. And you know what's more difficult? There are two scenarios. The mother is killed, and there is no mother anymore, and no one can substitute for a mother. And the second thing is that we still are having trouble with is that the Israeli side clears the kid, but does not clear one of the parents. And so the child does not want to leave. He wants his mother. I mean, he doesn't care about the prosthetic, he just doesn't care about these things anymore. And so this is also another theme of, just harassing these innocent children in a different layer that we don't also talk about. Yeah.
And what is happening? I mean, there are tens of thousands of thousands and thousands of orphans now. So how is the community responding to to these children who have lost both parents?
It's difficult, really. I remember working in a shelter school months ago, and I had this child, this little girl, and she gets inside the clinic. You ask her, "Where's your parents? Where's your older brother?" And I just can't deal with her alone. And her answer was, all of them were killed. And she said that in a very calm demeanor that I still can't process it anymore. It's really difficult. So I think the community is struggling to survive. The distant relatives are having difficulties surviving on their own. They want to take care of these kids, but they're struggling. You're talking about a community that most of them lost their livelihoods, lost their loved ones, lost everything. And now they have this extra burden of taking care of that child. And there is no financial capabilities, the educational system that, usually tries to alleviate and soak up the pressure of taking care of the children 24/7. There is no mental health care centers. I mean, before October 7th, the mental health sector was already lacking in Gaza. Let's not lie about this. And there was a need because we've been through a lot of wars. I've been there, I've witnessed many things as a child. I've seen bodies mutilated and people shot in front of my eyes. I've seen airstrikes, but there's no feedback, let's say, group or like, hey, let's reach out to these specialists and so on. And it is really difficult. The community tries its best. I have relatives that I know. I lost my uncles and their wives, and we have this child that was quadriplegic, and we suffered for months trying to get her abroad, and it was too late. This girl only can move her own biceps. That's it. That's the only muscle she can move. It is really difficult. It is. Yeah.
Right. Tammy, in some ways, you and a few colleagues are in a unique position in the sense that you're a bridge between the world that you experience in Gaza and the world here, in particular the United States. And it must be extremely difficult to be able to process knowing what's needed, and the lack of response in the US. If we asked you, and it may be a difficult a difficult answer, but if we asked you what are three things that we should be doing as healthcare professionals, as citizens, and as people who have some humanity left, what would you say? And
Yeah, I think I think it's a good question. I think anything that you do has to center supporting our colleagues. It has to center their needs. So while it is difficult, I'm not going to pretend that it's not. It is difficult seeing what we've seen in Gaza and then coming back to the United States and seeing that life generally carries on as normal. Coming back, you really get the sense that how can that exist and this exist at the same time, right? You just feel like everybody should be screaming at the top of their lungs to make it stop. So really a lot of what healthcare workers and humanitarian aid workers who return are asking for is not only solidarity, but solidarity in action with our Palestinian colleagues. So it's, the things that I would say that we are capable of doing as citizens of the world, and particularly as citizens of the United States, is things like pressuring for an arms embargo. I think that's well within our scope, right? I, as a physician, feel empowered to pressure for things like suspension of weapons licenses and arms embargoes, because it is directly impacting the health of the patients that I work with, right? It is by far the easiest way to ensure that our healthcare colleagues in Gaza are able to deliver adequate healthcare. When the bombs stop raining down, when there is no shooting, when there is when there is no weaponry being deployed against them, then we can successfully ensure maintenance of healthcare services. The other thing I would say is it is the things that are necessary to do from my perspective as an aid worker in the United States is things like pressuring for increased humanitarian aid. As I discussed, less than 0.4% of disinfectants are being allowed into Gaza right now, or have been allowed into Gaza right now. And that's unacceptable by any metric. It's unacceptable in any other part of the world. And so exceptionalizing Palestine and exceptionalizing Gaza is the wrong thing to do. I think we need to contextualize it a little bit better, right? This would never fly in Ukraine. This would never fly anywhere in the world. And for some reason, it's being allowed to do so in Gaza. So pressuring for increased humanitarian aid, pressuring for opening of the borders, all of those are important, and amplifying the voices of Palestinians. I don't think I can emphasize this enough. The amount of censorship that happens, even for just healthcare workers in Palestine, and I'm sure Dr. Majed has experienced this, for healthcare workers in Palestine who are choosing to speak out, they are actively being suppressed, not only on all social media platforms, but they are physically in danger if they speak out about this. I've had multiple healthcare colleagues who have been targeted and abducted by Israeli forces at checkpoints for wearing medical scrubs, for wearing medical clothes. And then they are subsequently taken to these detention centers and tortured for undisclosed periods of time before being released. They have committed no crime other than they are healthcare workers, right? So, and Human Rights Watch has released a report on this, the detention specifically of healthcare workers and their torture. So really, in particular for me, pressuring and advocating our medical institutions to stand in solidarity and to oppose practices like this, because it threatens the security of healthcare workers worldwide. I mean, we see an unprecedented death toll of humanitarian aid workers. And I think we have largely, as a medical community and as a humanitarian community, failed to mobilize our institutions for this. The American Medical Association, the American College of Emergency Physicians, the American College of Family Physicians. All of these institutions have failed to come to the defense of Gaza in the same way that they came to the defense of Ukraine. So those, I say, would be kind of the big actionable items that can truly move the needle in terms of helping our colleagues and centering their struggle.
Okay. Let me ask you another question that is difficult to ask. So one of the things that you just mentioned is to get these various academies and healthcare organizations, health professional educations mobilized. The American Academy of Pediatrics actually stopped discussion on the section on global health listserv, terminated it, stopped it for several days. I've been working with through multiple colleagues around mobilizing children's hospitals to accept children. And I'm embarrassed to say that the response has been less than tepid, worse than tepid for sure. So clearly what you're saying, Tammy, is great, but it's not working. And so maybe this is a rhetorical question, but one that we do need to address in collaboration with other organizations like Rebuilding Alliance and so on and so forth. What is the next step? And what will it take to get to the next step? And we're looking at, Majed, and he depends on us. And would you say that we as a medical community, as a healthcare community, are failing? And if we're failing, what Einstein said, continuing to do the same thing over and over again and expecting different results is absurd. That's a paraphrase. That's not the exact quote.
It's the definition of insanity, yes.
It's the definition of insanity. And if there's anything that describes what's happening in Gaza, and we'll talk about Sudan and other places and the Democratic Republic of the Congo and so on and so forth. So what's next? And
no, I don't think that's a rhetorical
the burden
question.
falls on you and your colleagues who have been there in ways that, we can't speak with the validity and credibility with which you speak.
Yeah, no, I don't think that that's a rhetorical question at all, Jeff. I think, if the pressuring is not working, the next most logical step is that you put your money where your mouth is, right? We stop investing in these institutions with our membership dollars. I mean, if we went and canceled membership of like 15 to 20% of the American Medical Association, it would bring them to their knees, right? These institutions live on the dues of practitioners who subscribe to them and who subscribe to their services. So there are initiatives right now ongoing to find ways to disinvest in the American Medical Association and the American Academy of Pediatrics. All of these organizations that claim to advocate for the rights of patients, right? So we really should be putting our money where our mouth is, working on ensuring that our trainees do not subscribe to these institutions as well. If, my residents who come through, I tell them, cancel your memberships. If this is something that you believe in, cancel your membership, send them a letter telling them why you're canceling your membership, and refuse to reinstate your membership until something changes. And in that way, it's almost a domino effect, right? Like we can exert all of the pressure we want. And Jeff, your experience is right on par. I mean, we've had talks canceled. We've had, petitions fall on deaf ears. We've been directly to their offices and in assemblies trying to pass these resolutions to no effect. So I think really that's taking it to the next step.
Right. And Donna just texted about supporting joint statements about really addressing our legislative representatives. Majed, what would you say to your colleagues outside of Gaza, in particular in the US and perhaps in Europe, what would you say to them? What would you say to us?
Well, I mean, this is something I mentioned before, is that we all have sworn a Hippocratic oath. And we are all humans. And we're not less human than you are. And like if you especially like the doctors who risk everything, some of them risk and lost their jobs to come here in Gaza. Of course we're not less human than the other world, the rest of the world. I mean, what Tammy is saying is great, protesting against these big associations that are, in a way or another, supporting the genocide that is ongoing, or is silent or refusing to release a statement, even though the healthcare state, the healthcare situation in Gaza is clear and is undoubtedly inhumane for anyone, period. Like regardless of your, political or religious background, what is going on in Gaza is inhumane and should not happen. What is going on is a violation of the international law. It's a violation of the Geneva Convention. It's a violation of the every UN decision. Just there is no way around it. And those who decide to remain silent because, well, they may lose their job or they may get some negative feedback from specific communities, it just, in other words, as I said, it is complicity in supporting what is going on. Because, like Tammy's full voice is so important, because Tammy can speak out, can convince her colleagues and co-workers, and they can also make a change. Like it just needs one person to start this domino effect, this chain reaction. And it doesn't matter if it takes time, like Rome wasn't built in a day, and the situation here won't be improved tomorrow if we're gonna, if the American citizens especially started pressuring from tomorrow. Probably nothing is gonna happen if you're gonna protest tomorrow. But it's all about incremental change, I mean, Dr. Jeff today is alone working, but tomorrow he brings his co-workers, his other academics. Oh, this is wrong. At the beginning of October 7th, everyone was not really, most people really didn't care for Palestinian lives, and they were having a lot of wrong ideas about specific minorities. But nowadays, the situation is clear because people were fighting to clear their image. And this is what our co-workers in America and in the West should also do. Just speaking up about it is good. And putting your, I don't know, I forgot the idiom that Tammy said it, but the gist. Yeah, I mean, if you have the ability to protest, to unionize against these, and you can make a change, like don't convince me otherwise. Because as Stanley said, most of these people are living on their money, on your tax money, in other words. And so why not force them to make a change? And you can easily make it. It just takes time. And yeah, I'm really thankful for those who are speaking out and speaking out day by day. It's really heartwarming to see that people are just, collaborating, coming together, sharing this voice. And every day we're seeing new faces of healthcare workers, of academics, so really esteemed people like you, Dr. Jeff. And it's really an honor. And I'm really grateful, and we should fight in every way possible. Even my way is different than yours, but we all have the same goal. Yeah.
Absolutely. One of the ways that we have found to be most effective when doing congressional advocacy is asking for very, very tangible things. So can you tell us what supplies, medicines, and assistance are needed the most right now?
I mean, it's really ridiculous. I mean, same thing that Tammy said, like we're not even able to clean our hands properly. Sadly, the Israelis have lowered the bar for what we need here in Gaza. They're asking for actual like alcohol gel and iodine and soaps. It's just like, we guys did it. We let these things in. And this is a disappointment. Everyone should be ashamed. The international should be ashamed for us not being able to provide this. You know, once I posted this video about me being frustrated about lack of like proper monitors, lack of blood pressure. The cuff was not working, and these pulse oximeters are bad. They're still bad, by the way. Nothing improved. Still bad. And we're lacking these disposable items, the chest tubes, the even laryngoscopes. We really need a huge amount of disposable items, but also a lot of these medications that we need constantly, the chronic disease, the non-communicable disease medications for hypertension, for diabetes, for people with a stroke, with heart conditions. We need a lot of antibiotic creams. We need a lot of bandage. We don't have bandages, by the way. Like bandages, gauzes, Vaseline gauzes. A lot of people, I'm struggling to find Vaseline gauze for that child that got amputated because he had burn wounds in his body. We're really struggling to find these things here. And if you're telling me this is not tangible, if someone comes and says this is not tangible, this is just ludicrous. We're just asking for the bare minimum. We as Gazans here are not able to have shelter, proper food, proper clean water, drinking water, and the winter is approaching. I personally don't have winter clothes, by the way. My family doesn't. And we're just struggling to have these basics, and yeah, I mean, if these are not tangible, what is?
Well,
Nisreen and Dr. Majed is absolutely right. The shifting list of items that is allowed and isn't allowed it's quite ridiculous, right? And the fact that when you go to Congress, or when I, as recently as last week, was in Congress, and I tell our congressional representatives, like, that there is no soap, right? There's no soap in Gaza, there's no disinfectant. And they're not aware. Because the information that they're receiving is coming from sources that make it sound like trucks are being let in. In reality, there is no logical reason to prevent people from having access to soap, to clean water, to cleaning materials, to gauze, to bandages, to pulse oximeters, blood pressure monitors. The restrictions don't make sense, right? And so when I advocate, I say, not only do you need to let in more humanitarian aid, this needs to be a process that is not left up to Israel, right? This needs to be a process that carries international weight and international consensus. The fact that there are trucks at the border that are waiting to be let in, all the trucks at the border should be let in without restriction, right? Like that has to be emphasized in all of our undertakings with congressional representatives. Anybody that says that morphine is a dual use item is out of their minds. That idea should be stricken immediately. Dr. Majed said it very eloquently last week. What kind of weapon am I going to make with a bottle of Tylenol? I mean, these things are absurd. And anytime, if you talk to anybody with any amount of logic and sense, they will tell you, yeah, that makes sense, right? And so this is the line of reasoning that I start with our congressional representatives. I was not allowed to take bottles of Tylenol and ibuprofen with me. These are very basic pain relievers. Me as a humanitarian aid worker, as a doctor, I cannot bring these into Gaza. It's absurd. It's an absurd line of reasoning, especially as an American citizen, right? As an American citizen, I would think that I enjoy rights, especially with our bilateral agreements with Israel. I would enjoy rights and privileges to be able to do certain things. That's absolutely not the case. So in all my dealings with congressional representatives and with, departments that have some kind of authority in this, that's my first line of reasoning, is that there's no reason to restrict these things. We need you to exert your diplomatic pressure to be able to let things in. It's the first most logical step, and Dr. Majed is absolutely right in expressing his frustration. It makes no sense. It makes no sense to anybody, and the fact that we have to continue to scream about this almost a year in is it's profoundly disheartening, and it's leading to moral distress and burnout.
Yeah. Well, Donna brings up a couple points, but one of which is that Rebuilding Alliance is available to help support us in mobilizing, in bringing the voice of people like yourselves. And maybe this isn't the right forum to discuss it, but tens of thousands of physicians emerged from their from their hospitals with white coats for Black Lives. And it was really tremendously successful in making a statement. And so I do think that there are some examples that we can learn from, not the least of which is Black Lives Matter. And Majed, your statement is just haunting when you said we're not less human than the rest of the world. And I think if there are words that we can use to manifest what is happening in Gaza, I think those are really very powerful words, powerful words. And maybe that needs to be part of a rallying cry for us, in particular in medicine. We just have a few minutes left. There are not many questions and answers. There are a couple of comments. And
I say, Dr. As constituents of the United States, Israel's biggest ally, do not underestimate the power that you all have by contacting your elected representative and your 2 senators and continuing to ask them to intervene and use the levers at their disposal to help. This can actually go a long way. And even as you do run into hurdles, continuing to show up, as Dr. Jaber said, and as Dr. Tammy mentioned, continuing to be persistent with your advocacy to your congressional offices and continuing to ask for what is needed and necessary is so important. Rebuilding Alliance has been asking for additional supplies to be let in, opening the borders, allowing for medical evacuations. And I highly encourage you all to continue to develop that relationship with your congressional offices and not to stop even as you run into hurdles, because it's so necessary.
Yes. No, this is a comment. So would 1,000 or 10,000 pediatricians and other physicians showing up at the Capitol at the same time. And that's something we really need to think about. Well, let me just say that of all of the groups that I've been involved with over the years and invested in, Rebuilding Alliance has been the most consistent, most diligent, most focused on a particular issue. And I don't know that the world really recognizes what you've been doing and how effective it's been, and how much we should be appreciative of the work that you're doing. And so we'll continue on. Majed, thank you. for your courage, and thank you for all that you're doing. We'll try not to fail you. And I think your words, we're not less human than the rest of the world, are ones that need to reverberate and reverberate and reverberate more. And Tammy, thank you for all that you've done and are continuing to do. And we'll have to convene maybe and think about what are the next steps as far as what the medical community needs to be doing. Again, with the help and support of Rebuilding Alliance.
And on a final note, next Wednesday, Rebuilding Alliance will be hosting a briefing with a group, a delegation, in honor of International Peace Day. We will have 2 speakers from Gaza and 2 speakers from the West Bank. It will be in the Visitors Center next Wednesday at 3 p.m. And the delegation will be composed of 4 youth, 4 young people, 2 who are under 18 and 2 who are 20 and 22. We hope to see you there.
All right. Well, thank you again. Thank you, Rebuilding Alliance. Ms. Reed, do you want to finish us up?
Yeah, I'll just underscore the importance of reaching out to your members of Congress. Please do reach out if you want coaching or need any help with that. We're happy to assist. And like Dr. Jeff said, we will try not to fail you. Thanks, everyone.
Thank you.
Thank you all.